Hi, this is Dr. Hauser coming to you from Frederick, Maryland on a nice rainy day. I wanted to dispel some myths about CBD or cannabidiol. It's become a pretty hot topic lately, especially with Maryland having recently allowed medical marijuana in the state, and people are getting a little bit confused about the different terminology out there between medical cannabis, THC, CBD, hemp. So let's talk a little bit about that. So, like I said, the state of Maryland has approved medical cannabis. Medical cannabis or medical marijuana has in it substances known as phytocannabinoids. And these substances you may have heard of, such as CBD, there's THC, CBC, CBG. There's a lot of these TLAs, three-letter acronyms. So THC is what's probably best known for marijuana, and it's what gets you high. It gives you the munchies, gets you couch locked, but it's also got a million medicinal properties to it, and I'll do a separate video on that. Then there's a phytocannabinoid that's also found in cannabis called CBD, cannabidiol, but it's also found in a plant that's related to cannabis called hemp. Now, you can go to the grocery store and you can buy hemp seeds today. I've got a bag sitting in my pantry. It's made from a plant that's related to cannabis, but it has none of the psychoactive components. So you can't get high from taking CBD. That's sold legally in the state of Maryland because it has less than 0.3% of THC. That's an important point. Now, if you get CBD from an authorized distributor that follows those guidelines, it has virtually no THC or zero THC. For instance, I have some in my Hauser Health shop that's pure, has no THC in it. I do make the company that makes it for me prove that there's no THC. If you go to a medical cannabis dispensary, those products are a combination of CBD, THC, and all those other phytocannabinoids. You won't necessarily get high from those. It's possible to take that and have the medicinal benefits, but if you were to get drug tested, you probably would pop positive. So that's one important distinction, is the psychoactive component to CBD versus medical cannabis, and whether or not you would drug test positive for it. So CBD is made from the hemp plant, and it's distilled. You want to make sure it's organic. The reason is because it's a scavenger plant, meaning that it takes up everything from the soil. So for instance, in Russia, I heard that they use this to plant around Chernobyl to soak up the radioactive soil, and then they pull the hemp out and dispose of it properly. So it's very important that you get organic hemp first of all, and it's one of my priorities because I don't want to be taking in all that extra junk, those extra poisons. What can you use CBD for? Well, it's most commonly used for inflammation, anxiety, and sleep. Those are the big ones. Now, there's a whole host of other things. For instance, there's a lot of talk going on right now about using it for irritable bowel and leaky gut. And I think there is some benefits to that. But right now, the main three that have scientific evidence, and I have anecdotal evidence from my own patients, are inflammation, anxiety, and sleep. So I've found that taking it myself, I've been able to really control some just general aches and pains and some knee pain. I do take it with some other products, such as high-dose turmeric to help out, but it's been great for inflammation. For anxiety, it's been wonderful. You can go on it throughout the day, and then if you have a period of anxiety, you can self-dose at that point to help control it. And then if you take it at bedtime, it can also help with sleep. Now, in the beginning, I found that if you take CBD right before you go to bed and you're not experienced with it, it will tend to keep you up. And it's because it has some mental clarity to it. And so what I found was when I took it at 10 o'clock at night, I felt awake and I felt mentally clear, and I wanted to keep reading my book. So I started taking it about 9 o'clock, and that gave me time to relax, do my stuff, and then fall asleep. Now I can take it right before bedtime, and it helps me sleep wonderfully. So that's just a brief introduction on CBD. By all means, if you have any questions, please feel free to post your comments. And if you'd like a video explaining anything else, by all means, let me know. Thanks. Have a great day.